Here in Central Virginia, government leaders are taking a regional approach where the coronavirus is concerned.
Dr. Danny Avila serves as public health director for the city of Richmond and neighboring Henrico County. He says COVID-19's elusive nature makes it difficult to spot and stop.
One of the challenges is that when 80+% of individuals who get the virus have really kind of indistinguishable cold symptoms, they can transmit the virus to people who are much more susceptible to it without really knowing it.
That alone, he adds, significantly increases chances the disease spreads to this community.
I'm very concerned.
Why?
Because people don't know how to cover their mouth.
I'm scared for more older people and younger people, but not necessarily for myself.
Hoping to address growing concerns, health and emergency management leaders here have activated an incident management team for the region.
And so now, instead of each locality having to make their own kind of best guesses or decisions based on the information they have, that will all be streamlined through a regional infrastructure. The decisions that we make collectively about whether to hold a basketball game or, that affects not just the people in one locality, but those have regional implications.
That also includes decisions like closing schools, businesses, or even advising churches to cancel service.
I mean, if we're having widespread transmission and we're starting to see deaths here in Virginia, and again, I fully expect all of those things to happen, then I think there will be clear guidance to faith communities and congregations to say, maybe we do a web service this week or for this period of time. We probably do need to make changes in the way that we're delivering communion.
So I think the church has an opportunity here, really, to show that it will practice its faith over fear.
Richmond Community Church Senior Pastor Rick McDaniel says he doesn't foresee canceling any services.
I think we would always have church, and we always have the doors of the church open. We'd always have services, and then people would have to make up their own decisions about whether they want to come or not.
Now, states have the ability to test locally for COVID-19 rather than having to send samples to the CDC in Atlanta. Still, Avila says the availability of test kits is limited, and the required criteria for testing means cases will slip through the cracks.
Health officials stress people should not panic, but they should remain vigilant, realizing that curbing everyday social norms like shaking hands may be the safest idea. In Richmond, Virginia, Eric Phillips, CBN News.